Okay, so I'm just going to open up my Zoom now. It's 5:30. I've got all of the participants in, which is exciting. All right, I'm going to share my screen and we're going to get started. So, a little bit about myself. My name's Emily Baker. I'm an oral health therapist and orofacial myologist. So, I focus on really good growth and development from day dot. And I think that's the big reason why I wanted to do today's dental talk was empowering parents that we can prevent things like braces and poor oral health by putting some good foundations in place. And the best way to do that is by empowering parents with this education. So I'm an oral health therapist. I studied out at Wagga Wagga. Since then, I've done my advanced adult scope, and I'm also an orofacial myologist. So we work on things like correct tongue rest position, breathing, and strength of the face. We work really closely with people like speech pathologists, OTs, and people like that. So a lot of the time, I focus on pediatric dentistry. I also do restorative work on adults as well as oral hygiene on adults. But I also focus a lot of my time on anxious adults and children, as well as neurodiverse patients with ASD, ADHD, and special needs. So, yeah, that's kind of the group that I enjoy working with. All right. So, to get us started, we're going to be talking about the feeding journey. So, this is so important to be getting right from the start. And it really does start, and every feeding journey is different, whether we are breastfeeding or bottle feeding. But to set our child and ourselves up to have success with either options of this feeding journey is to be ensuring their soft tissues are functional. So things like a tight labial frenum, so your lip tie, a restrictive lingual frenum, so the tongue tie, they're really important to make sure that they're functioning well. So these areas can be reviewed by people like lactation consultants, dental practitioners, and orofacial myologists. To be really fair, in uni, we weren't taught very well on these areas. And as emerging evidence is coming out, more and more people are getting more knowledge on this area, which is good. Um, so it's really important that we're having a correct feeding journey. And what that looks like is having a correct flange of the lip with the ability of the tongue to be thrusting forward for a correct sucking and swallowing response. And what this swallowing response is going to be doing is setting up our child for long-term growth and development and be helping to avoid things like speech concerns, breathing concerns, and poor oral health as a whole. So, while we're on the topic of feeding, there is a huge misconception that breast milk causes decay, which is not the case. For a long time, I feel mothers were very well shamed in a lot of kind of health standpoints, which had no evidence based practice behind. So, the breast milk is simply made of a simple sugar to get energy quickly to your baby. And when this is mixed with bacteria, remnants of food or drink when they're reaching the solid stage, as well as increase in oxygen flow if they're mouth breathers, a combination of all of these concerns will then cause decay. So, if you're able to clean away the bacteria before that milk sits there for too long, we can reduce the risk of decay. So, ways that I get parents to do this is by wiping their children's teeth with a muslin wrap or a wet face washer. You can buy things like teeth wipes with some ingredients to help neutralize that acid, but I think wiping it away with just a muslin wrap is perfectly fine. So there was a pretty good systemic review on this back in 2000, which tells us that there's no definitive time in which an infant should be weaned for breast milk. And parents should begin an early and consistent mouth care regime. So, pretty much what they're trying to say is continue breastfeeding for as long as you feel comfortable. As long as you're including a good oral hygiene regime, which includes a balanced diet, water after meals when age appropriate, and wiping away that biofilm or bacteria. So, this is an example of what a tight frenum looks like. This is your labial frenum or a lip tie that's shown. So, the presence of this skin is actually normal. We call it a frenum, and that's what we should be looking like. However, when there's tightness and a poor functionality, that's when we're having a concern. So, what we'd be looking at is this tightness will be preventing a flange over the nipple or the teat if we're bottle feeding when feeding, which is a big concern. And then moving further down the track, when your child started solids, this labial frenum can start pocketing food up right next to that tight skin attachment. So from there, the other concern is this blanching. So the white area that we're finding along the bone line. And what that can be causing concern is overall tightness. And this is where we're looking at a whole body concern. When we're having fascia and tightness within the body, that means the rest of our body isn't able to be working as well as we'd like. So there have been studies to show that things like a tight labial lingual frenum, so your tongue tie, can be impacting all the way down to your toes. So the fascia is a long piece of attachment starting from the tongue all the way down to your toes. So if it's too tight, that's going to be putting off for the rest of your body. So it's important that we're able to address it properly. So I do hear from a lot of parents in clinic that they're nervous to be getting these releases done. They think that, well, they've heard the dialogue of tongue ties and lip ties are being over-released. And look, it is fair. Some people just release it because of the appearance without taking into account functionality, and that is concerning. But in saying that, we are also wanting to be shifting from the dialogue of dismissing parents and mothers that breastfeeding, it's normal for it to be painful. It's normal to hear clicking. Your child is upset because they've got colic, and that's just a part of being a baby. And unfortunately, that's first, not evidence-based practice. And second of all, that's really misleading because it's actually not true. A lot of the time, clinicians sometimes have a bit of an ego, and if they're not sure, they just dismiss. So if you feel in your gut that there is a concern, go with your gut and get a second, third, fourth opinion on these concerns, because what we'll touch on later is it does have a really huge impact on how your child's oral health and growth and development is growing, essentially. All right. So some symptoms that we might find of a tongue that's restrictive or a lip tie that's also restrictive is with a coating of film on their tongue with milk. And that can very commonly be disguised or treatment planned as thrush. That then means that we're exposing our children to antibiotic treatment or further treatments that's probably not warranted. And that's purely because this is the top of the mouth. The tongue, when anchored at the bottom of the mouth, is unable to go to the top and move like a wave to get that milk to the back of the mouth. And at the surface of our mouth on the palate, we have little bumps and grooves called rugae. And the job of that is to clean it. So we also find coating of white film on children and adults of all age that has a low tongue rest position. So their tongue's not resting in the correct spot, which is up the top of the palate. So it can also be having clicking noises, colic, influencing reflux because we're getting additional airflow through the feeding, as well as a painful feeding for the mother. What these can then cause is further worsening of colic, an improper swallow response, meaning it's harder for a mature response to be established down the track, an inability to latch if you are choosing to breastfeed, as well as a low tongue rest position. So the tongue isn't suctioned to the top of the mouth when you're at rest with the lips together, as well as open mouth breathing. So a good practice for people to be doing now, if you have your lips together, when we have our lips together, our tongue should be suctioned to the top of our mouth with our teeth slightly apart, and that should be our neutral position. When we have something anchoring our tongue to be touching low in the mouth, try and get your tongue to touch your lower teeth now with our lips closed. It feels like you need to open your mouth. So if we're not addressing this, we're already preempting our children to be mouth breathers. And that then puts them at risk for things like sleep disordered breathing, sleep apnea, changes in how their teeth are growing and needing orthodontic work. So look, this very small piece of skin attachment can be having huge long-term concerns. So if you are ever concerned or you do have a suspicion that there is a tongue tie or a lip tie, go and see that second, third, or fourth opinion. So, how can we positively influence our children's oral health? So, these are some just really quick tips that we'll elaborate on in this webinar. So, the first is by drinking with a cup or straw only. Sippy cups were invented by a father back in the 60s or 70s, and the intent of that was because drinking from a cup is so messy, and he saw a market where he could kind of profit from this, because we all know we love convenience. However, what that does is, rather than when you're sipping from a sippy cup, the tongue thrusts forward to stop the flow of the water. And what we get is a piston-like movement of the tongue, which is a poor swallow response. Rather than when we're sipping with water, our tongue raises to the roof of the mouth, moves like a wave in a peristaltic movement to get to the water to the back. So in summary, using a drink bottle with a straw only, brands like B-Box and any kind of other straw or vessel to drink out of that needs you to change how you're swallowing isn't great. So just keep it simple. As well as including resistive foods that require chewing. So this is a hard one. I say this when we can, because certain medical conditions, swallowing responses, and pickiness of children is going to prevent this at times. But doing all we can to be including a resistive food and diet. So that means things like meat, if we're a meat eater, things like steak, beef strips, trying to avoid slow cooking or pressure cooking every meal. Because what we really want to be doing is really using that chewing muscles, and that's going to be helping to promote the growth of the mouth. The next one is avoiding pre-packaged convenience foods. So when I say that, what we want to be using is is things like yogurt pouches or fruit or squeezy kind of fruit pouches. And the reason for that, first, again, it has that piston-like movement to stop the flow of the yogurt or the fruit. So that's not a great swallow response. But they're also really high in simple carbs, starch, and high in natural sugars, which coat the tooth and can cause decay. As well as we want to be looking out for some red flags for sleep, breathing, and their overall growth. So one thing that I get asked a lot in clinic is it a problem that my child's still using a dummy? And look, there's no right answer for that. Ideally, as a worst case, we want to be getting rid of the dummy by, at the latest, 4 years old. And that's because that's where that really big growth response within the mouth is happening. However, ideally, for behavior response as well as growth in the mouth, 6 to 12 months is the sweet spot on when we want to be stopping the dummy use. In between that time, we want to be limiting it to just soothing and sleep only. So we don't want to just be putting the dummy in whilst they're just relaxing and doing tummy time and things like that. We really want an ability for a good lip seal, their tongue to be suctioned to the top, and a good rest position to be achieved. So going into and throughout my pregnancy journey, I thought I wouldn't be using a dummy for my baby. But that very quickly changed, like motherhood and parenthood does. You can't plan everything. But my child, Alfie, was needed to be admitted to special care for a little while, and to make sure that his non-nutritive sucking, so the sucking response that he's getting at birth, is able to be established, a dummy was needed to be used. So we had to use a dummy from day dot. However, we generally like to say, if we can, wait until breastfeeding or bottles are fully established. So their feeding has really been well established, and that's between 4 to 6 weeks old. But in circumstances like Alfie's and a lot of others, that's not really achievable. So just do what's working for your child and your children. From there, I guess that silicone can get really quite dirty if it's dropping on the floor and it's the dogs are around and the pets are around and it's touching surfaces. So it needs to be cleaned regularly. A way that I like to clean it is with some hot water, a bit of bicarb soda, and some vinegar. You can buy some sterilizing like Miltons and things like that. So use that, whatever's more convenient. But the biggest thing we do not want to be using is our saliva to be cleaning the dummy. And the reason for that is because the bacteria within our mouth is transferable through saliva. And the microbiome within the mouth of our baby is so new, and we need to be allowing that microflora to be flourishing with healthy bacteria and not putting them at predisposed risk for things like decay and gum disease, where that bacteria can be transferred from our saliva. So, on that note, we also don't want to be sharing a toothbrush either. Keep our toothbrush to ourselves. And when we come down to how to get the brushing in for our children, I'll have some more tips on this. So, teething is something as a clinician, I think I was quite naive before having Alfie. I would look at the poor parents with their child teething and saying, look, you'll be fine. It's a couple of days of misery, which isn't too fun, but you can get through it. No, that's not the case. I've got lived experience. I can go for weeks at a time. But by putting some good foundations in place to help nurture your child while that's happening is helpful. So we know our child's teething with things like red cheeks, drooling, restlessness, changes in their eating habits. They may not want to be eating, disturbed sleep, as well as a mild fever. Teething can be really tough, but the good thing is that there are things that can be done. And the other point to make is every child has their own timeline. So just because we have this teething chart here doesn't mean that it's exactly month to month. Every child has their own timeline. So just take this as a guide. So things that we can be using for teething that I really liked from an evidence-based perspective, as well as a learned experience with Alfie, is using a few tools. So first, and the probably first point of call is using a cold munching tool. I really like long objects like the Nubs teether, the banana teether, the Arc Therapeutic baby grabber, because I find a lot of the teething tools on the market are quite round, which is great for the first 4 teeth. But as soon as they're getting the back molars, they can't physically get that far up the back. So having a longer vessel to be getting and chewing on those back teeth will be really helpful. Around the age of 6 months, that's also going to be helpful for good oral play as well. So these teething tools just to be chewing on before we start solids can also be helping to promote a bit of a gag reflex. And that can help to reassure you that your child has an active gag reflex. So when we're starting to introduce solids, it's not too fretful. We know that the body's doing as it should. From there, we can also put it in the fridge or freezer, and having the cold can be really helpful and soothing. Traditional advice would be giving some analgesics like Panadol or Nurofen to be helping with the teething symptoms, reducing any fever as needed. However, I guess from long-term use from a young age of things like Panadol and Nurofen, that's going to be starting a really poor process of our liver detoxification and how our body's responding to things. So some homeopathic options, look, they aren't evidence-based. However, I feel comfortable using them and recommending them to my patients, can be helpful as an adjunct to that traditional advice with the Panadol and Nurofen. So my favorite is the Weleda baby teething powder. I was very hesitant to start using it, but with some research, it's pretty well just chamomile. And when I feel unrested and I feel like I just need to relax and soothe myself, I reach for a chamomile tea myself. So I feel comfortable with it just being chamomile and oyster shell, which is helpful. And I really have found it does really reduce the symptoms of Alfie's teething, as well as any kind of irritations throughout the day. The second to that is actually spring onions, chewing on the end of a spring onion. It's Not evidence-based. There is some evidence to say that it could have some anti-inflammatory kind of results, which will be helpful with teething, but nothing to say that it's kind of the magic cure for teething. It's also helpful when they're starting solids to be introducing new flavors. So I also gave that a go, and it was pretty helpful. So, the biggest thing I wanted to talk about in this teething realm is the use of Bonjela. Over the last 12 to 18 months, the therapeutic guidelines in Australia have no longer recommended teething gel, irrespective of the ingredients within the teething gels. And that's because there's a lack of evidence of efficacy and the potential for harm. So, that's based off the 2023 TGA statement. A lot of the benzocaine gels that are used at a high enough dose can actually reduce the oxygen flow through the body, which is pretty massive for a young baby. Having things like Bonjela and just having a free little squeeze, you actually don't have any ability to measure out how much you're applying. So only use things like Bonjela as a worst case scenario, and try and exhaust those other kind of steps beforehand. In my oral health guide for parents, we have a bit more of a comprehensive guide on a few other teething tools and teething don'ts. So if you're wanting to know some more, check that out. And that comes with the webinar that we've discussed today. So this is my Alfie now. He is 16 months now. And this is him eating a salad the other day, which was pretty crazy. But what this is showing is from a young age, we started with a mix of purees and baby-led weaning. And by starting solids at 5 to 6 months, it helps to develop a positive swallowing response. And that's going to be the biggest thing to building a healthy oral cavity and avoiding things like braces, mouth breathing, and gut health concerns in the future. So what it does is with active chewing, these muscles are then working in their correct function. And with correct muscle movement, that changes the bone structure within the face, the jaw, and the skull. So that's called craniofacial growth. And we're really working on the muscles of the head and neck with that. What starting solids also helps with is fine hand motor skills, hand-eye coordination, and their ability to chew. So after about 6 months, their mature swallow response is starting. And if that's nurtured and we're really following good chewing and swallowing habits, then that's going to be maintained well into infanthood and as an adult, which is what we want. So things that we do want to be doing during this time. And look, I give yogurt pouches to Alfie, but what we do instead is we put it on a spoon and we feed it to him with a spoon instead. It's not for everyone, but baby-led weaning and starting solids from an age of 5 to 6 months has shown massive results in helping with gut health, oral health, and overall growth and development. So this is Alfie with his first meal ever, which was a piece of steak, and he absolutely loved it. And he definitely is still a steak fan to this day, which is great for his health, not great for our pockets, but hey, we've got to do what we've got to do. The other thing we want to start doing when solids are introduced is offering water afterwards. And that's age appropriate. So after 8 months, we can start giving some small doses of sterile water afterwards. And that's going to be washing away any of the biofilm or food content from the mouth, gums, or teeth. And one thing to know, when Alfie started eating steak, he didn't have any teeth. So that was all gummy. That chewing response was still done without any teeth. And you got a really good source of heme iron. So a big thing to be touching on with diet is iron is so needed for children at this age. And we'll touch on some things that are marketed with good iron that isn't very bioavailable and not great for overall health. So we'll come to that. While we're giving that water, to be avoiding giving it from a traditional bottle with a teat, we want to starting to be using a straw and an open cup. So the biggest thing when starting with an open cup is getting a small cup, filling it all the way. Because if you've got a small amount of water, the child's going to hold on to the cup And then first thing we're going to do is tip back the water and it's going to go all over them. So if it's filled to the brim, I know it sounds a bit counterintuitive, but if it's filled to the brim, you'll then be able to drink a lot easier. So moving on from there, we also want to be trying to reduce our formula-free feeds from 12 months of age. And that's purely from a health and oral health point of view. There's obviously children that need to continue having night formula feeds depending on their growth and their diet throughout the day. So please take your own health advice based on that. But unfortunately, a lot of people actually think that formula is needed for stage 1, 2, and 3, even 4 as they get older. And a lot of the time, it's actually marketing from the formula companies. And if you look at the ingredients list, there's not a huge change in nutritional changes. It's actually advice from the Australian Health that formula and milk is actually not needed from 12 months of age. Breast milk can continue to be given, but formula and cow's milk is not needed. So if we are still giving children milk, whether it's breast milk, bottles, or cow's milk before bed, what we ideally want to be doing to avoid decay while having that is by having a bottle, have a bath or brush teeth, and then be going to sleep. Having that feed to sleep association is going to be hard to break, and having that milk coating on the teeth overnight is going to be really detrimental to their oral health. So the reason why we say bottles at night is worse is primarily because we don't have saliva production whilst we're sleeping. So there's nothing to be washing away that biofilm or that sugars from the milk. So it means that our teeth are just constantly getting an acid attack. And we'll explain more what decay is and how an acid attack occurs in a moment. So yes, sticking to that routine of bottle, bath, bed, and that's going to be helpful to avoid decay. So one big thing that I'm not super huge on, and I think there needs to be more information on this, is that convenience is really compromising our children's health and development. And that's because as a society, this is more of a society shift. Even I myself went back to work at 6 months and really felt the pressure to get back into the workforce. So I was leaning on those convenience foods, things like squeezy pouches with kind of those foods, those rice crackers and baby mums and things like that. None of them are supporting a nutritional diet, although they market it that way. I don't know how a pouch that's shelf stable that's been on the shelf longer than my child's been alive, still has the nutrients to be able to help with good nutrition for my children. But the thing that's even more staggering is that shelf-stable food pouches aimed at children have the highest recall rate in grocery stores. So that's pretty wild to me. It's really, really unregulated, this area. And over the last kind of 18 months to 2 years, there's been a big crackdown on what's inside and marketed with these kind of tools. But yeah, look, I would be doing a deep dive if I was you on kind of what's inside those kind of pouches. So another reason why we don't like having soft purees for longer than a few weeks when we're introducing solids is because that doesn't promote a chewing response. So it's harder for your children to be getting that mature chewing and swallow response because there's nothing to chew there. So look, continuing with soft purees as you feel comfortable. But by investigating in things like the Solid Starts app, maybe investigating with a Tiny Hearts first aid course, talking to your match nurses, they're going to be the best resources for you to feel comfortable on what is the best option for your child and your family on this solids journey, because it's not the same for everyone. So again, we don't want to be offering our children juices or soft drinks, dipping our bottle or dummy in things like jams or honey and things like that. But look, as reassurance, I've been there. It is really scary with finger foods. Gagging is normal. We want to be seeing that. But before we start solids, it's really important you know the signs and how to assist your child if choking does occur. So there's been some really big investigations into the health of these convenience foods. My mother, my grandmother, my great grandmother, they all of their first foods were things like baby rice and Cerelac. And that's because that was the normal. However, we know a lot more through evidence-based practice and research on these products. They're probably not the best starting for our gut microbiome and starting our children off for the best health outcomes either. So there was a big study on the Australian infant pouches, and a lot of them don't meet the NHMRC recommendations. So what that is telling us is that the iron content, so the fortification with iron, actually isn't meeting the recommendations as marketed. These foods like baby puffs, rice cereals, they have been shown to have high levels of arsenic and other heavy metals. So things like teething biscuits and rice rusks. A lot of them also have been claiming of no added sugar, which doesn't mean that there's no sugar at all, and were made for 59% of pouches despite the addition of free sugars. So they're making some pretty massive claims on their marketing, and that reels in a lot of parents. And without looking at the nutritional information, you'll be none the wiser. And by starting your child with a predominantly simple sugar is going to be feeding poor bacteria within the gut microbiome. We'll come to this in a moment, but how dental decay starts is through simple sugars on the tooth, which rice and those kind of products with the rice puff snacks, rice cereals, the teething biscuits, that is a breeding ground for dental decay to be starting. So I am one of moderation. Myself have given this to my son. I've given the baby mum rust to my son. In times of desperation, in times of convenience, it's okay to be giving our children these things sometimes, but just knowing that if it's the only option, it's okay. If there's better options, maybe we can look at them. So I thought it would be important for us to be showing you what a proper swallow response actually looks like. So what we'd be wanting to be doing is having our
swallowing or deglutition is the process by which food passes from the mouth.
So we want the tip of our tongue touching the roof of our mouth and getting to the back. So having a bolus that's quite thick and quite large and having that ability to swallow. So the importance of that is it's going to be teaching proper chewing response and the ability of our tongue to be raising and having good strength there. So 50% of the mouth and airway develops before birth, and significant amount of that growth happens before the first 2 years of their life, which then influences their adult-like feeding skills. So avoiding those things that we're talking about, like the 360 cups, sippy cups, and to be really using things like a straw or open cup. And yeah, that would be helpful. And look, even with things like if we are continuing formula and using express breast milk, even giving our children that in a open cup or a bottle with a straw is going to be much better for their swallow response than using a traditional bottle. So I keep coming back to gut health, and that's because there is a massive correlation between oral health, gut health, and brain health. And we really need to be setting up our children for excellent gut health, because I'm seeing far too many children daily at my practice that are 7, 8, 9, 10, and they've been having a lot of cow's milk, which has been marketed to our generations, our parents' generations, that it's good for healthy growth of bones and teeth. But one overconsumption of cow's milk, which is more than 400 mils a day, which generally is about 2 cups a day, this actually stops the gut lining being able to uptake iron and other vitamins such as vitamin D. So iron deficiency can be causing things like grinding, poor sleep quality, dental decay, as well as preventing the uptake of other key micronutrients like vitamin B, C, D, and K. And those particular vitamins are important to keep your oral health healthy. So if we're having them low, that puts your children at a higher risk of gum disease and dental decay. So one thing that also increases concerns with cow's milk is casein. So that's the A1 protein within cow's milk. Casein has been shown to increase the risk of inflammation in the body. And this happens through congesting our lymphatic system. So our lymphatic system is actually joined as well with our soft tissues like our tonsils and adenoids. So with an increase in infant formula, increase in cow's milk being offered from the ages of 12 months onwards, we're seeing an extraordinary amount of children that's now needing things like tonsil removal, adenoids removal, mouth breathing, gut health concerns, anxiety. And look, if we get back to the simplicity of our overall body and health, if our gut health isn't doing the right thing, that's going to be playing a huge part in all of these other concerns. So one switch that we can make is by using A2 milk. Look, it is an extra couple of dollars for a couple of liters, but I find that's a really easy switch for most families, because once we've got that kind of habitual use of milk in our diet, whether that's with cereal or cups of milk, it's really hard to get out of that. And I don't want to be the person to say you can't have this, this, and this. So having a switch to A2 milk might be a good option. All right. So the next thing that we wanted to touch on is red flags for children. And on my website, I have a free downloadable on red flags that you can download, you can review and see if your children or yourself are facing these concerns. And you can take that to your dental clinician. And from there, they can help you on your journey. Things that are common but are significant red flags are things like snoring, heavy breathing, and that doesn't necessarily have to be it's just a noisy breathing with their mouth open. Grinding is a massive red flag. Grinding tells us that there is a stress response happening with our body, whether that is an airway response from a lack of oxygen, or reflux can also be a big contributing factor to grinding. Open mouth breathing, restlessness or waking unrested, daytime drooling over the age of 18 months, not eating resistive foods. They're really keen on having those kind of softer foods, as well as frequent burping or hiccuping. So again, a lot of these concerns come down to, if we look at ourselves as a whole person, not just our teeth and our mouth, it really comes down to gut health again, and how we can be promoting good health and reducing inflammation in our body. So keep an eye out for them. If yourself or your children have any of them, be proactive. Let's see an orofacial myologist or an airway focused dental practitioner to help avoid these progressing. So how do these red flags come into play? First, allergies tend to be a big one. So whether they could be airborne or have intolerances, things like oral habits, whether you're using a dummy, thumb sucking, chewing on toys or clothes. So what that does is prevent the good growth of the teeth in the mouth, as well as influencing the tongue to be dropping low. Enlarged tonsils, adenoids or turbinates in the nose, having things like reflux, poor growth within the mouth, which influences mouth breathing, as well as a gut dysbiosis and inflammation. So while we're here, what influences the growth of the mouth is our tongue and our lips. What the tongue does is make a broad U-shaped like motion, and that's through the tongue being rested on the palate when we're neutral, so when we're not speaking or eating. From there, ensuring a good lip seal is going to help prevent the teeth from growing outwards. So if we have those two things, that's a really good starting point for growth and development. And all of these concerns can influence one or the other. So these are some long-term influences if we don't see those signs and symptoms. So just like what I was showing you here, if we have a low tongue rest position, that means the top of the palate, rather than growing broad, goes high and narrow. That can then have issues with speech disorders. So if your palate's up here and your tongue's trying to work, we're not able to articulate our words properly. Craniofacial changes, so like this top photo, you tend to be a more vertical grower than a horizontal and broad grower, which then increases the risk for orthodontics. With mouth breathing, that also increases the risk of oral health concerns like decay and gum disease. And that's because with additional oxygen flowing past the teeth, that then activates a more aggressive bacteria within the mouth. So, all in all, if we're addressing this from the ages of 0 to 5, we can put in preventative strategies to avoid getting ourselves to teenagehood needing complex orthodontic work, needing speech concerns, feeding therapy. So, look, we really want to get on that preventative pathways. And that starts by knowing the red flags. So, what do we do as a parent with all this information? Check your child while they're sleeping. If they sleep in their own room, are they restless? Are they hot and sweaty? Do they snore or grind? Do they wake overnight? I put after 1, it's probably closer to 2, that's becoming a concern. Check, how are they breathing? Are they lips together? Are they lips apart? Are they nasal breathing? We then want to be limiting the use of our dummy or pacifier to only soothing times, as well as drinking water through a straw. So, with all this information, if you do see these concerns, who do you see? I find a good orofacial myologist or an airway focused dental practitioner is a good starting spot. And that's because they've got a really good baseline of this. Our medical system as a whole can be quite flawed in the fact that we all have our own lanes, and we're not very good at putting the puzzle pieces together and how everyone matches in to make us as a whole person. However, our GP may refer us to be seeing an ear, nose, and throat specialist, a sleep physician, an allergist. But the one thing that I'm finding some really good results from is by seeing an allergist and a naturopath, because they are able to put the puzzle pieces back together. As I said, the body is made up of multiple systems that are related. Therefore, a lot of the time, multiple people are needing to be seen. The body and health concerns are a journey, so we need to be willing to investigate those root causes rather than putting a band-aid on these concerns. All right, so this is more of the traditional dental that we would kind of be used to seeing from the dentist. But the biggest thing we want to be doing as a parent is flipping the lip, seeing that gum line, because that's a very common spot for decay to happen. No bottles to sleep, water after all meals, avoiding sticky foods. So I find foods like dried fruits, biscuits, rice crackers are more likely to cause decay than things like lollies and chocolates. The chance of a child these days having a healthy diet and having lollies and chocolate at most meals is really unlikely. But when we start doing kind of a diet history of your most children, we're having things with simple carbohydrates and things like wheat bix or cereal for breakfast. We're then giving a sandwich for lunch. We're having pasta for dinner. We're having an oat muesli bar in the afternoon. All of these are simple carbohydrates, and I'm not saying to get rid of this. It just tells us that the bacteria in our mouth will eat up those foods a lot quicker than foods like proteins or fats, which we'll come to in a moment. So it's important, if we are having those foods, to know what to do as well as eating to avoid decay. And what that looks like is by having lots of water to wash away the foods and to ensure that really good oral hygiene and having lip seal, lips together and breathing through our nose is going to be really important. So that's a bit of a summary of what we'll talk about. And look, I hear this every day with parents. Why do I care so much about baby teeth and why are they important? And that's because they hold the spot for the adult teeth in place. If we remove this baby tooth, this 6-year-old molar is coming up, and then it's going to be drifting into its spot. And then that means complex orthodontic work. So by using preventative strategies through things like flossing, brushing, and good diet can save you thousands of dollars in your pocket for complex orthodontic work. This also reduces things like infection. So if we leave decay for too long, it does cause infection, which can become an airway risk. But this bacteria has been proven to increase your risk for things like Alzheimer's, poor gut health, poor heart health. So we really are not only caring about your child's tooth health, but your long-term overall health as well. So this is a good picture to see what early decay looks like. Through flipping the lip, you can see along the gum line that white hue, and that's the very start of decay. The good news with this is we can prevent that from becoming a hole and needing a filling. How we prevent that is by using a remineralizing agent, which is a toothpaste or a cream, making sure they're breathing through their nose, and from now on, adequately cleaning. Another thing we want to be looking at is wear marks on the biting surface. So we can see that on these teeth here. And these wear marks indicate some grinding. So other factors that can cause this are things like reflux, mouth breathing, and an acidic environment or a bottle to bed. So other than along the gum line, probably the more common area that I see in children is decay between the teeth. And that's because most people don't know we need to floss teeth as soon as they touch together. And I know it sounds really dreadful trying to even brush your child's teeth, let alone flossing them, but that's going to be super important to avoid deep decay on children through flossing. All right, so we're going to get back down to science here so you guys really know what decay is, and we're not just told it's lollies and chocolates that's causing this. So anytime anything other than water enters the mouth, it creates something called an acid attack. So carbohydrates that are fermentable and simple sugars break down a lot quicker in the mouth than things like fats and proteins, and they release acid or creates an acidity. So the mouth works like a seesaw. Every time we eat something, the mouth becomes acidic, and then the job of saliva is to neutralize that acidity. We then have our next meal, we have saliva. To help neutralize that quicker, having water will also help, as well as waiting 30 minutes after our meals to be brushing our teeth. So it's best to be sticking to 3 main meals, breakfast, lunch, and dinner, and a snack between these times to allow our mouth to neutralize back to neutral to avoid an acid attack happening for too long. So for adults or for older children, chewing gum can help stimulate our saliva as well. And that will help our oral cavity become neutral and remineralize our teeth. So an acid attack pretty well is when the bacteria in the mouth digests the food and then excretes an acid. So it pulls minerals from your tooth, and the job of saliva and toothpaste is to put the minerals back in or remineralizing the tooth. So this happens over multiple times of the day, and we constantly have a change of acidity within the mouth. So what influences that acidity really is our diet. So a balanced diet is something that would be involving a complex carbohydrate, good source of fat, and a protein. And we want to be aiming for that for most meals to be helping with oral health and gut health, in addition to making our body being satiated so we're not as hungry as quick. So that's going to help hopefully prevent snacking in your young children. So a diet higher in simple carbs and sugars increase your risk for decay just because that bacteria eats that acid up a lot quicker and excretes it for a longer time before it can be neutralized. Complex carbs have something that changes our blood glucose levels called our low GI or high GI, which you might be seeing in packaging of your food. So what that does is a complex carb, any carbohydrate that breaks down to a sugar spikes our sugar. So our sugar gets spiked by carbohydrates. What happens is if we have a complex carb with things like sweet potato, whole grain pastas and breads, nuts, legumes, what that does is rather than skyrocketing from a jelly bean, let's say, and going down and having a crash, we're having a long kind of curve that's balanced. We go from there. And what that plateau of our blood sugar spike is going to be doing is also keeping us fuller for longer and allowing less inflammation to be happening as well. So things that cause decay are things that get stuck to the biting surface of the teeth, as well as things that are high in sugar. So things like white breads, lollies, sugar, kind of soft drinks or juices. Rice crackers and cereal are really big ones. So switching those kind of meals, and it's quite an easy switch, really. Rather than offering things like just a plain cereal, looking for a low GI oat, for example, or eggs as an example for breakfast foods with berries, rather than foods like kind of apples and things that are really going to be spiking that high GI. When I say fruits, it's a hard topic to be spoken about because fruits are a part of a healthy diet. I'd much rather a child reach for an apple than a lolly, but that's just for an example. All right, so from there, fats and proteins break down at a slower rate than a carbohydrate does, and that also keeps your child fuller for longer. So when we're trying to get a balanced meal, we want to be looking for kind of equal parts of a complex carb, a fat, and a protein. So fats may include things like full-fat yogurt, butter, extra virgin olive oil, avocado, peanut butter, or a nut spread. Good fats aren't to be feared. For a long time, we had a lot of dialogue around how bad fats are, how bad full cream milk is, how bad butter is. That's not the case. Evidence-based practice shows us now that that's not the case. And those good fats are actually needed for our cells to be replenishing themselves and to be used as energy to get basic functions done as a cell in our body. As well as that, protein like meats, fish, tofu, full cream milk, cottage cheese, eggs, lentils, and quinoa are good sources of protein that will do the same thing. So now we've spoken about diet. Before we move on, I have a really great downloadable free diet advice PDF, and that really steps through how to formulate a balanced diet, some additional macronutrients like omega-3, probiotics, and fiber that we want to be getting into our oral system to be helping with oral health, but also overall gut health as well. So you can find that on my website, and that's a free downloadable under the resource section. So moving on to toothbrush and toothpaste. If anyone's walked down that aisle recently, it goes forever. And there are so many options, and it's very confusing as a consumer on what's the best thing to be doing. So hopefully I can debunk a few things now and give you some advice on this. So the biggest thing is to be cleaning our teeth is the manual removal of plaque that prevents bacteria from causing an acid attack and prevents gum disease. So if we're eating and there's no bacteria to cause the acid attack, it's going to be easier to neutralize. We want to be brushing as soon as the tooth erupts. So it's important to be brushing from day dot. That's going to help to avoid decay, but it's also going to help get into a habit with your child. We want to be replacing our toothbrush every 3 months, and anytime after we're sick, the bacteria harbors in those bristles, and that can just prolong our sickness. We only ever want to use a soft manual toothbrush. Things like medium or hard toothbrushes, the only good thing for that is using it to clean the grout in our shower. A soft manual small head brush is what we need. We want to be flossing as soon as the teeth touch. And parents need to take on the responsibility of flossing and brushing until their children can tie their shoelace. It is important that they're building some of their own habits with their brushing. So letting them do it by themselves is important, but making sure a parent does it afterwards. So I like to start by wiping the teeth and the gums with a muslin wrap, getting used to using one of those little silicone finger brushes. Then moving on to a small round brush. If you have a child that likes to clamp down on the toothbrush, doesn't let you get the brush in, a 3-sided toothbrush can be really helpful. And that means you can still brush the teeth while they're clamped down. As another suggestion, you can get a teething tool and they'll bite down on one side, and that will give you room to brush on the other side, then alternate to brush the other half. I think it's impossible for me to be expecting brushing to be done for 2 minutes for children. So get in for as long as you can. If you can't get a thorough brush in for the nighttime brush, make sure it's a really thorough brush for the morning. Taking off expectations from parents. Consistency is much more important than perfection. So just do what you can when you can. So there's a lot of marketing towards the U-shaped brushes as well. The silicone brushes doesn't remove plaque adequately, and kids tend to gag on it because it's such a large appliance. It doesn't meet the gum line, and that's where the plaque begins its life. And unfortunately, parents rely on this too much and the children to be using it themselves. And 3 to 6 months later, we've got a mouthful of decay because we haven't been brushing properly. So do not fall for the Instagram marketing on this U-shaped brush. So we really want to make brushing experience as positive as we can. And I'm a huge fan for using apps and distraction when we can. So I put some examples here, depending on their age bracket. The Wiggles Brush Time with the Wiggles has a good app. The middle one is Disney Magic Timer. And you can use lots of Disney characters, Marvel characters, Mickey Mouse. So that's a really good one for any age bracket. And yeah, that one's helpful, as well as Pokemon Smile, which is pretty fun for the older kiddies. So again, just do what you can when you can is really important. So we've already touched on the importance of flossing. The biggest way I find to, or the easiest way to get flossing in for children is if they're lying on your lap, you use your index finger under their chin, use your thumbs to move their lips out of the way, and that's going to be easier for you to get the floss and be visualizing down into their mouth. Making sure the handle's sticking outside of the cheek, just so you can get an easier floss towards the back. If you see any teeth that aren't touching, that's what we call self-cleansing. So we can leave that. But as soon as a tooth touches, flossing has to start. So the biggest thing that I find is this toothpaste brand, Jack and Jill, is really, really, really marketed towards parents and mothers that want to be doing the best for their children and avoiding any nasty additives. The thing with that is it has no ingredient that will remineralize the tooth. Essentially, it's a paste that's flavored that mimics the feeling of toothpaste, but has no remineralizing factors. So 2 products I want you to look out for, and they have similar efficacies of remineralizing the tooth. First one is fluoride. That's tried and tested. I am on the cards or the advice of do what you feel comfortable. Fluoride has been kind of jammed down everyone's throats for a very long time as dental clinicians, that fluoride is the best option. That isn't the case. Fluoride has now been shown that there could be some other health implications, and we can't disregard that. So with more evidence, we'll know more. However, in that time, if you don't feel comfortable using fluoride, it is important we're doing something for the teeth, and that's through a product called hydroxyapatite. So that long word, which I'll narrow down to HA, HA is really good because it's actually an organic material from the tooth. The enamel on the outside of the tooth is made up of 96% of HA, and what we're doing is using that organic material to remineralize the tooth. Another product that's commonly marketed to parents is xylitol, and that is a really great product. It's actually been shown to aid in reducing the amount of growth of bacteria, and is now commonly being added to traditional toothpaste such as Colgate and Oral-B. The biggest thing with toothpaste is for the whole family, we don't want to be rinsing. We want to keep it in our mouth for 30 minutes, spitting out the excess to allow the minerals to be uptaken by the saliva. So if we're going the traditional route, Colgate, Oral-B or McLean's, we want to be using a product from the first time a tooth is erupt, and we want to be using a rice grain of toothpaste only. We want to increase the dosage determined by their age or depending on what their dentist or dental clinician recommends. And then by the time the first adult teeth have come through, we can then transition to an adult strength toothpaste. A more natural toothpaste that has hydroxyapatite or low fluoride will also help with remineralizing. So some good brands to look out for is Grin and Grants. I have a comprehensive guide in my oral health guide for parents on different toothpaste and their efficacy, what ingredients they include. So that's going to be a good one to look out for if you're confused on what to use in the toothpaste aisle. So, not just our kids need healthy oral cavities, us as parents need to take care of ourselves as well. And the best tip I have is investing in a water floss. Water floss is a device that spurts out high pressure water, and using some warm water and going along the gum lines like a U-shaped motion and holding it between the tooth for 2 to 3 seconds has the same efficacy of removing plaque as string floss does. I, for one, even as a dental clinician, know it's really hard to get floss in our daily routine and habit. So if we're habit stacking those tools by showering and using a cordless water floss at the same time, that can be really helpful to avoid gum disease and decay. Also, brush our teeth in the shower. If we're breastfeeding or have a new baby, and you have one of those little nappy caddies next to the lounge, use a toothbrush there. It doesn't have to have toothpaste, and just get the brushing in. Through modeling, taking care of yourself has a huge impact on your child's behavior and their willingness to give brushing a go. If toothbrushing and flossing is your normal, that will very quickly become their normal as well. So, what does the first dental visit really look like? We want to be seeing a dental clinician anytime from when the first tooth arrives. So, that could be as early as 4 to 5 months old. That's important to be conveying tailored advice to yourself and your family based on your diet, oral hygiene, whether they're a mouth breather, and they can really tailor a good regime to you. So again, this is just another snapshot of a brief timeline of when teeth come through. But look, it's normal. This is textbook age. I have children that are 3 months old that get teeth. I have kids that are 15 months old and just getting teeth. So that's all normal. So the first dental visit, what that looks like, we want to make it as fun as we can. As a dental clinician, I have no expectations for what that first visit looks like. But to make it as positive as we can, that starts with you at home. So showing them photos of the practice, what we expect to be doing in the waiting room. We may have to wait in a chair at the front for a little while before our name gets called, and we get excited for before our name gets called. If they have photos of the rooms, we can show a photo of the dental clinician you're seeing, the room that they're seeing. And even better is role playing, lying them down on the lounge, using words like opening wide like a crocodile, counting their teeth, and making it a play-based experience is going to make it more of a comfortable experience for them. I think especially post-COVID, there's a lot of children with a lot of white coat syndrome where stepping into anywhere medical is really difficult. So by starting it off well at home and not having any expectations coming in can make it a less stressful experience as a parent. So yeah, look, thank you all for attending. I hope we've learned a couple of tips that we can take home. For those on the Zoom and with the recording, this all includes my take-home resources, which includes my oral health guide for parents, which has a comprehensive guide from in utero to 5 years and beyond on all the things we've already touched on today, plus more. If we don't have access to that, then you can view my free downloadable resources on my website. That's really looking at, as a summary, red flags for children. That's a downloadable that you can tick and see the frequency of your children and what they're doing with their sleep, breathing, grinding concerns. And that's a good tool to take to your dental clinician. And my second downloadable is diet advice, looking at macro and micronutrients, including things like fiber, omega-3, and probiotics and how helpful they are for our oral health, as well as a fun task with eating the rainbow and really involving our children in making good decisions for their health. So look, if you enjoyed what we spoke about today, follow me at Smile and Glow by Emily. I obviously, as you can see, love talking about teeth and oral health and overall health. So if anyone has any questions, feel free to shoot them over to me and I'll be very willing to answer. But again, thank you for investing in your family's health, in your child's health, and taking this time to listen to the advice given today. If any of the things that we've spoken about doesn't sit with your own advice given by your dental clinician, then continue going with your dental clinician's advice because that's all tailored towards your family. But again, thank you for your time. I'm going to stop sharing my screen now. And if anyone has any questions, I'm going to be on here for a little longer. But again, thank you all for the time today. All right. All right. I think I'm going to leave it at that, guys. Have a good night. Bye.